To our July 7th, 2022 Douglas County Board of Commissioners last day of budget hearings this week. I'm gonna go ahead and kick it off to Sarah. Do you?
Thanks. Thank you, commissioners. Let Bob mute his, yeah. Do you hear us? Can you guys hear us? Okay. Today we're starting off with behavioral health partners, and Bob, our director of behavioral health projects, Bob Tryansky, is going to lead us through an overview. Bob?
Good morning, everyone. First of all, I'd like to welcome all of the partners in the Behavioral Health Leadership Coalition who are here today. As you know, in the county budget process, you receive budget requests from each of the agencies in that coalition. So that includes Burt Nash, DECA, Heartland RADAC, Heartland Community Health Center, Lawrence Douglas County Public Health, the Housing Authority. I always forget one, LMH Health, which does not have a budget request this year in Douglas County. Those are the 9 agencies in the Behavioral Health Leadership Coalition. And one of the things that makes this budget process a little bit complicated, but not insurmountable, is that we have these separate requests linked to priorities that are both in the behavioral health plank of the Community Health Improvement Plan and linked to priorities, community priorities overall, where we're going in behavioral health. In 2017, before the position of Behavioral Health Projects Director was created, and as the Behavioral Health Leadership Coalition was coming together, there was some opportunity in that budget cycle to get started on a series of initiatives. So there are 2 pieces to where these requests fall in the Behavioral Health Project spreadsheet. One is on property tax. There was a $1.9 million mill levy that was allocated under the tax lid before the tax lid closed in 2017 that allowed us to get started with some initiatives. And then as we worked towards Proposition 1 and getting the behavioral health sales tax passed, which now brings in about $4.9 million. So, you know, all in all, there are $7.1 million allocated to behavioral health initiatives supported by Douglas County. And what I want to do is I want to walk you through the priorities that we have. Go ahead.
That's absent of our community partner funding, Bob. So
Correct. These are sort of new initiatives since 2017, specifically related to what started off as the crisis center conversation and then expanded to supportive housing. So as you know, we've talked about this before, the Behavioral Health Leadership Coalition, the goal in this cycle of the community health plan is to build an integrated system of care that moves from crisis and illnesses as a norm to recovery and prevention as a practice. And there are 3 focus areas in that plan. One is to prioritize prevention. The second is to promote integration across the system of care. And the third is to improve access to care. So what I want to do is I want to walk you through the priorities for the coalition, the Community Health Improvement Plan, and then how those priorities are linked to the funding requests you received from the agencies in the Behavioral Health Leadership Coalition. So the first focus area is prioritizing prevention. And we do not have any new priorities in that section of the plan, but just to walk through, we want to continue to support strategic planning, data sharing and analysis, and projects that reduce risk and bolster protective factors to address substance use and suicide prevention countywide. There's some work that's being done in the community health plan to kind of revise some of the objectives that were set in 2018. And one of the things that the prevention strategy team is advocating is to elevate a focus on youth initiatives and initiatives that are designed to bolster protective factors and reduce risk factors. So the recommendation in the budget request is to maintain support for Engage Douglas County's Prevention Coalition and return the funding to $170,000 for 2023. In 2022, we took some of the funds that had originally been allocated for prevention strategic planning, and we placed some of those dollars with KSPHQ as they were working on continuing to implement zero suicide. And as DECA was successful in receiving a drug-free communities grant from SAMHSA, which kind of bolstered the dollars available to DECA and the Engage Douglas County Prevention Coalition for this work. So some of the things that fund include supporting the Douglas County Youth Prevention Board, convening a Douglas County Behavioral Health Summit, something that went offline as a result of that reduction in funding. So we're hoping to bring that Behavioral Health Summit back in 2023. Implementing good behavior game pilots in Douglas County elementary, pre-K, and community youth program settings. The sources of strength pilots in Douglas County secondary schools. Handle with care partnerships between law enforcement in all 4 jurisdictions in Douglas County school districts. Implementation of the federal drug-free communities grant. And one thing that's important to know there is that that's a $125,000 grant a year, and part of the requirements of that grant are that that be matched. So the county's funds of $170,000 go to match the $125,000 that it's applied in that way. We want to continue to expand the MyStrength user base, so we continue to work on that and to develop strategies. We've gotten feedback from our coalition partners that one of the paths to success is to really see MyStrength as a tool that is helpful in treatment settings, and to increase the provider training so that there's sort of a direct engagement path and introduction to the MyStrength tool, in addition to what we've tried to do to promote it throughout the community. And there's been prevention doesn't just happen within the BHLC. There's a lot of work that is also shepherded, stewarded by LiveWell and the work of LDC Public Health. So we want to continue to support tobacco cessation and anti-vaping initiatives. So again, there's no new funding requests per se in the prevention strategy area. And these are the priorities and kind of the initiatives we're trying to support. Are there questions there?
Yeah, we have a supplemental request for the Behavioral Health Summit in our packet. Is that included in this 170,000?
It's not.
Okay,
It's not been built into the proposed budget.
okay. And then talk to me about the cost of implementing the good behavior game. Sources of Strength has been awesome in schools and we get a lot of positive feedback on it. Talk to me about the cost for good behavior game.
So I can't speak specifically to the specific cost of good behavior game, but what I can tell you is that it's an initiative that's being implemented primarily in Baldwin, although Eudora is now also looking at it, and we continue to have conversations. The hope would be that good behavior game would be available in, across the community in these settings. So the dollars that go to DECA to support implementation of good behavior game, it's similar to the way the dollars are spent with sources of strength, and DECA is not here this morning, but we could get back to you with the specific costs in there.
Yeah, do you want
I'd like
them?
a cost on that one.
Okay.
Yeah.
Other questions?
The current cost of what we're currently
Yeah,
spending?
what we're currently spending,
Okay.
what percentage of the 170 that's there? I know DECA's not here today.
Okay, we can do that.
Can you talk just a little bit? Handle with Care is new because I serve on the leadership team, but I think it's important for commissioners to understand what that is in case commissioners know, they know. Okay, never mind.
So yes, do you want me to talk about it a little bit or we're good? Okay. So Handle with Care is a partnership between school districts and law enforcement. When law enforcement are on a call and there's obviously a young person involved who is experiencing trauma, the law enforcement will do a direct message to the school district that says, handle Johnny, Keisha, Danelle with care. And what happens then is that Handle with Care notification is then disseminated to that child's teachers so that there is knowledge without getting into the weeds and the details that this individual had a difficult time and deserves some different type of attention over the course of the school day. We started doing this through the leadership again in Baldwin of Police Chief Mike Patrick. And over the last year, there's now commitment from all 4 municipalities to implement Handle with Care and work with the school districts to do that. So it's not a new initiative, but implementation in all the districts is really what we can look forward to. In 2022, we're working on that now, and in 2023. Okay. Second area of focus is promoting integration across the system of care. And there are a number of initiatives that we've been working on for a while. and some new things, tweaks or adjustments. So the Data Sharing Collaborative has been working for several years to foster and steward collaboration, data sharing, and shared analysis of data on a variety of projects that we're doing. And the goal of the Data Sharing Collaborative, one of the priorities, is to create a data repository. We've been working on this for about 2 years, so we're proposing to continue to maintain funding so that LDC Public Health, our Behavioral Health Leadership Coalition partners, and KU's Coffin Logan Center can continue to bring that repository online. I know Dan Partridge and Sonia Jordan are here from the Health Department if you have questions on that. Implementation of an integrated 24/7 crisis line and expanded mobile response. This is an initiative that's been in development and discussion, and you've seen proposals from KSPHQ and from Bert Nash to bring mobile crisis response online, and for that to be integrated and deployed with the efforts that we're doing with the 24/7 crisis line linked to 988. Again, the total budget for both projects is not an increase in funding in 2023, but the implementation in 2022 is going a little bit more slowly and more gradually than anticipated. And so the recommendation will be to support a full year of implementation of the 24/7 crisis line with KSPHQ, as you've seen in the contract that you approved several weeks ago, actually several months ago, and $425,000 to Bert Nash. DECA has been involved in providing peers. There have been conversations between the two, so I just put Bert Nash and DECA there as mobile response comes online. What needs to be said is that since we started talking about this, you know, Bert Nash has moved into becoming a comprehensive CCBHC, a comprehensive certified behavioral health clinic, which is now in place. And starting in July, the whole sort of funding structure and reimbursement for services under the CCBHC it's a totally different ballgame, as we've been talking about for months. As part of that, Bert Nash aspires to and is committed to bringing online a 24/7 mobile crisis response team. This is kind of a bigger project than was originally proposed and worked through the mobile response work group in the proposals that you saw in study sessions. And so there's some additional work I think that needs to happen to go back to that mobile response work group and discussions with the partners in the CIT Council, you know, how we want to proceed in fully implementing and what we can afford to do as we support bringing mobile response online.
Yeah, I think that's a topic we're going to need to talk a little bit more about this fall, is, you know, how that landscape changed for Bert Nash in terms of what they were putting together for the CCB now under a CCBHC. Also, just the importance of co-response. You know, the Criminal Justice Coordinating Council had talked about the value of a three-pronged approach for crisis, which was a treatment recovery center, a mobile crisis team, and co-response. And so now that we have Chief Lockhart on board and comfortable and knows where everything is, and you know, I think he can be brought to the table to kind of re-energize those conversations about co-response at CJCC. So more to come.
I know Stephen O'Neill from Bert Nash is here if there are questions on that. And I don't know if KSPHQ is here in person, but I believe they're online. Peer support. This would be the 4th year of the Peer Fellows project and a whole host of initiatives to add peer support across the system of care in the context of the programs and the service delivery model that our partners are implementing. And so in this upcoming budget year, what we'd like to do with peer support is to continue to support 6 to 12 peer fellow positions with community partners who commit to create and fund peer positions in year 2 and 3 of the partnership with the county. So one of the things we've learned is a 1-year commitment is probably not enough to do the work that it takes to kind of get somebody trained, identify whether they're appropriate for, continuing on in the program, whether they stay with the program for the year. And then we've lost, one of our challenges has been turnover in that peer fellows program, and the feedback we've gotten from the peers and from the agencies is that some of that is related to the fact that a part-time assignment as a peer is not always the optimal fit for the person, for the agency, or for the service we're asking them to provide. So we originally scoped this as 12 half-time positions at $15 an hour. What we're proposing to do is have more flexibility so that we could have either a full-time or a part-time position. And we would essentially, if it was 2 stipends, we would support that with $30,000 versus $15,000. So having some more flexibility as we move forward to continue to build that peer support workforce and to build a sense of community among the peers that are doing this work. So reestablishing a consumer-run organization and experimenting with a community-based peer first response model. So what would it be like if the co-responder team would have the capacity to call and connect with Heartland Radar or the mobile response team, and they would be able to deploy maybe a peer first before you send a mobile team or before you send the co-responder unit or before law enforcement employees. There's a lot of feedback we've gotten as our partners have engaged in things like the co-responder conference, CIT International, in communities where peers are doing a lot of street work, where they really are a different type of first responder. And so Heartland Radar is considering providing some more leadership for that type of a model and building those relationships with partners like Just Food, with the Senior Resource Center, and settings like community libraries around Douglas County. Questions on that?
This is Commissioner Reed. Did I hear you say that the goal is with the partnering agencies that the county is paying for the first year under the condition that they're committing to 1 or 2 additional years of maintaining that position?
What I'm saying is the county would commit to funding a position for 1 or 2 years. Okay, so let me give you an example with Lawrence Public Library. Lawrence Public Library was committed to creating a full-time position. And then in the midst of that process, the city cut their budget. So we stayed with LPL for an additional 6 months to make sure that we could keep that person in the program, supported at the library, and then transitioning to a full-time job. And I think that's one of the things we are learning. We want to keep that capacity that we develop so that those peers, if they've spent a year in the fellowship, are not just then going to move on to a full-time job, but they'll move on to a full-time job and continue to provide and exercise leadership and support and community building. So having more flexibility with how long that process takes, being able to keep somebody in the program maybe before a full-time job is open, having some flexibility to 1 to 2 year commitment, and then in the next phase of that, the partner would create a job. Is that
I
okay?
don't have any other questions about peer support.
One of the, I think, transitions and changes as the TRC comes online is that the BHLC has an opportunity to pivot some of its focus and pivot some of that focus and redirect that attention into supportive housing. So, we've been talking about supportive housing for several years. One of the things the BHLC's leadership, county support, has provided is opportunities to bring some more permanent supportive and transitional housing projects online, like Artists Helping the Homeless, Meraki and Kairos House, like Transitions on the campus, like the cottages on the campus. And we know, that we've created opportunities for like 38 units, beds that didn't exist 3 years ago. But as the supportive housing study has shown us, we need 174 beds. So we want to really focus and be able to take some of the behavioral health leadership's capacity and the work that's been done in the affordable and the safe and affordable housing plank of the community health plan and kind of elevate that as a focus over the next couple of years. So prioritize and operationalize the recommendations contained in that needs assessment, continuing to provide operational support for transitions, continuing to support Artists Helping the Homeless's, Kairos and Meraki housing projects, supporting clients in county-funded supportive housing projects with intensive care coordination and intensive case management services where necessary, and considering additional capital support for a transitional supportive housing project at DECA's Lakeview campus and supportive housing projects proposed under ARPA. You have been considering a variety of projects under ARPA. Many of them, there are some support, the things we can do to build our supportive housing capacity and inventory. And there's a line in the budget here to hold about $400,000 that could be used for additional capital support for projects maybe that weren't available to be funded under ARPA.
It's capital or operating. So, in essence, we're reserving capacity under the sales tax to do that work. Does that make sense? So it's not allocated towards a particular project. We also talked about using fund balance and behavioral health sales tax for projects. And so this amount comes out of ongoing sales tax. And we're reserving that capacity. It could be used, you've got some supplemental requests too as well from Housing Authority and tenants to homeowners. The question would be if they're all completely aligned with behavioral health sales tax. So, but does that make sense? To see if maybe you have a question, Commissioner Kelly.
I had a question, and that line there has sort of thrown my thinking a little bit. One of the things that we had through our ARPA process, Bob, was a request from Artists Helping the Homeless, and I see some of their stuff is embedded in this, but the project they asked for is not in this.
Right.
And so do we consider that in that 400,000, or if it's not in there, is that an opportunity? I think when we talked about it in our ARPA discussions, it seemed like it needed more conversation, especially with it sounds like it needs more conversation with the Behavioral Health Leadership Coalition.
Well, and I didn't receive a budget. I did not
Right.
receive a supplemental request for that. So, I generally don't. So
No, I guess maybe it's not a question, it's more of a statement, is I think that needs to go if it is behavioral health. And if we put the other Artists Helping the Homeless within the behavioral health package, it seems like that one needs to go to Behavioral Health Leadership Coalition to be talked about some more. That's really the space for it. And especially when we heard from Carwoo that some of the services they were providing were not necessarily, in my opinion, reentry, that they were expanding what those services were.
yeah, and I think that's the process question I want to tease out a bit, just
Mhm.
because we didn't have the Behavioral Health Leadership Coalition necessarily vet every supplemental request. This list comes from Bob and I in terms of our a summary of how things came together. If that is a desire of the commission to have the BHLC, weigh in on all supplemental requests, I've got to work that into the process differently. Because right now I don't have time for it. So if that's something, so we didn't really do that this year, so I don't want to leave you with that impression. But I do think conversations about supportive housing and its role in that is something BHLC should continue to talk about and probably needs to spend more time on. It's been happening kind of in the space between that and with the anti-poverty work. And Jill is here if you have additional questions on that work. So we could dig into that deeper if you want.
Yeah, I mean, I appreciate you saying that it didn't go through the BHLC. That's important. I think I have made a case for it a couple of years now that we use some of these collaborative groups to sort of talk about some of these budget requests. And, we've asked that from our historic groups that were here yesterday. I know Jill's done really good work with our social service agencies and so that I just think there's more opportunities for collaboration and when they talk together and when they're bringing us a proposal that they've looked at together. I also understand that it can divide them into silos at times and and fighting for their one thing, but that's just my opinion. I don't know what other commissioners think.
And we can, yeah, and I think it's something we can just continue to explore. I just wasn't clear that that was something that commissioners felt like they needed them to see the packet and see the, review each request and how to get that in my process and time. And I'm also just cautious of, we need to set reasonable expectations for that. The reason why a few supplemental requests were included in this budget, the proposed budget, are only because we had capacity under existing dollars for behavioral health. And I didn't want to diminish capacity on behavioral health in the proposed budget. That is a very unusual process, as you all know from sitting through this for the last 2 days. It takes a pretty tough bar to get in my proposed budget. So I want us to be thoughtful about that and consistent, because I don't give that same privilege to other community partners nor other departments. So we just need to think through that, and that with guidance you guys will need to get to me as I go.
Well, and one thing I would say is, two things I would say. The first is, last year we talked about convening a supportive housing work group so that integration, collaborative discussions, cooperation, and communication starts to happen. And Jill really has led that work. So it's not that the Behavioral Health Leadership Coalition, as that group of executives, have been vetting this, but it is that the partners in that coalition and others have. So, for example, Tenants to Homeowners and Artists Helping the Homeless, Family Promise, they have very much been involved in it's kind of similar to the conversations that happened with the Mobile Response Work Group under the CJCC. So it's not like this is coming in silo directions. There has been some collaboration and synthesis, and it's also been driven by, in this season, the dollars that have been available for ARPA are a unique opportunity this year. So I think that just gives you, again, a sense of the landscape on where we're going. And Shannon and I are committed as the conveners of behavioral health and affordable housing, and I know Jill, as the conveners in that part of the plank of continuing to sort of like have supportive housing conversation is something that bridges and sort of system spans among those three areas.
Yeah, and I was just going to mention that the supportive housing work group, that was the plan, that we were going to convene that group because it's an overlap with the BHLC and the CHIP and the housing community health plan and the anti-poverty in a lot of ways. But the hope was to get past ARPA, get past budget, and then convene that supportive housing work group that Bob mentioned with the stakeholders he mentioned, and take a fresh look at the CSH needs assessment, take a look at the recently finalized KUC PPR study, and where do we go from here? And look at things like what would it look like to implement a pay for performance model like CSH mentioned in some of their ideas and recommendations? How could we create one of those locally as we move into the future? But also, how do we critically evaluate proposals like expansion of Artists Helping the Homeless to serve women, and put some more data together to make a compelling case for that?
Obviously, one of the largest, or the largest line in this series of budget requests is for operational and ongoing support for the Treatment and Recovery Center in 2023. The recommendation is there for that not to exceed $3.4 million. As you know, bringing the services and the operation of the TRC online has been complicated and slower than we anticipated, due in part to CCBHC and that whole process, due in part to some of the additional hurdles we're going to have to get over with licensing the Treatment and Recovery Center in the absence of Crisis Intervention Center regulations that would allow us to have a Crisis Intervention Center license, and finalizing kind of a lease agreement and operational budget based now on what we know about the PPS rate for the CCBHC, what we know now that the state's budget has been approved over the dollars we can count on for fiscal year 22 and 23 under the current state budget, and how we move forward on this. So the recommendation here is that we hold a placeholder of $3.4 million, and because we may need up to that in 2023 to bring the treatment and recovery center online in the way it was envisioned.
And I think we're going to continue to crawl before we walk, before we run. So you'll be seeing lots of regular an extension. Now we're ready for this piece. Okay, I think we might be ready for that piece. So it'll be lots and lots of conversations.
And Dr. Thompson is here from Behavioral Health Partners. So if there's questions as we move through this, feel free. Youth Crisis Services. This is a priority that was identified during Proposition 1 to increase the number of youth crisis beds in Douglas County. That was the way it was worded and spoken about and conceptualized in 2018 as we pursued Proposition 1 sales tax funding. DECA, as part of their budget request, has put a proposal to improve services to assist families who are in crisis, to leverage the capacity that they have with families that have been licensed to provide crisis respite services under foster care, and to provide additional services, including in-house therapy and support for those moments in crisis, that temporary period of time where people are looking for crisis respite and services and sort of being able to maintain their child in the community. So this is Sarah, do you want to speak to this a little bit?
Yeah, so the proposal from DECA is to have them placed in specially trained foster homes, which is through their statewide work in foster care. I think we've got work to do in this space, and I know the O'Connell Youth Ranch and Children's Shelter are going to be here later this morning to talk about this. I don't know why it seems surprising that youth crisis is as varied and faceted as adult
everything else in
crisis, if
behavioral
not more so. So how, what specifically capacity do we think our community needs? Where O'Connell is primarily been PPC, so police protective custody, children placed in police protective custody, but that can be for a variety of reasons. And so I just feel like we've got to dig in a lot deeper here and get a sense of like what kids from Douglas County are going there now, why, and then how would this fit in? Should it be very different? Maybe it should be very different. Maybe we need 4 in that potential. And I just don't feel like I've gotten enough capacity yet to really feel like you have a solid plan. There's funds in this budget for this additional 2 beds. And then when we have the conversation with O'Connell, it's still a part of their total funding. I don't have a breakdown yet on O'Connell's funding. But this is something I'd like to continue to work on this fall.
Thanks, Sarah. I appreciate the background and how complicated this is. One of my questions is I was trying to figure out how would someone be placed either at O'Connell Youth Ranch or at DECA, and it sounds like there is a key piece of law enforcement that we need to have a conversation with of when kids are in police protective care versus when it's a youth crisis that may not go through law enforcement, and how that distinction gets made or doesn't get made. So as we bring DECA and O'Connell in on these conversations, it'd be nice to have our local law enforcement agencies, especially to make sure that they know that these resources are available to them as well.
Yeah. Right now, for the police protective custody, generally a child goes through juvenile intake and assessment at the juvenile detention center, which is administered by them. And that's all kinds of kids. It's, it's not just kids that have gotten into some sort of trouble. It could be kids in a domestic violence type situation or runaways. So that law enforcement is definitely in part of that process now with O'Connell. I think through the Crisis Treatment and Recovery Center and what will happen at the front door there, law enforcement may not be involved at all. And so, yeah, I think we've got a lot of work to do in this space to how do we figure that piece out. And that's where I'm saying, I don't feel like I've got a handle on it yet.
And so this may be more of a conversation for Monday and Tuesday is where we put that in our budget. If we don't have that clearly lined out and need to do some more work. We've had other projects where we felt like in the fall, we needed to massage it a little more. Okay.
One of the things that's unique about the Behavioral Health Leadership Coalition's work in trying to address the risks and the Douglas County specific challenges that we now understand from the data that's been gathered and analyzed and synthesized by the health department is to continue to apply kind of a total quality management approach in our healthcare agencies to recognizing suicide risk and preventing escalation of that risk. So the work of Zero Suicide continues, and there's really there are a number of pieces of this work, including KSPHQ and Lawrence Douglas County Public Health and the Data Sharing Collaborative are working together, for example, to move toward a death review board and working with the Douglas County Coroner's Office. That requires coordination with all of our agencies. So there are dollars in this request to continue to support KSPHQ and LDC Public Health as they continue to work and kind of steward and shepherd and support the work that's happening in each individual agency. Zero Suicide is something that's typically like it's implemented in a community in one healthcare agency or one healthcare system. What's unique about Douglas County is all of our partners have said we are going to implement Zero Suicide in our agency. And so it's a process, and the process continues, and there's funding in there to support that. Other questions? So then under improving access to care, here is another addition, new spending, expanding the intensive care coordination team from 5 FTE to 6 FTE and continuing to provide half an FTE of supervision. So that would take the care coordination service up to a $563,000 project supported on the property tax, consolidating funding and coordinating service delivery between behavioral health projects and criminal justice services, and then continuing to support the LMHED, TRC, transitions, the cottages, Lawrence Community Shelter, settings throughout the community and our system of care with this care coordination service, so that it's kind of a safety net until a person engages and plugs into the right care in the right place at the right time. The care coordination team is available to support them for up to 90 days, regardless of their insurance status, their payer source, or the issues that they're dealing with. Questions there? One of the big initiatives we started with in 2017 was trying to increase the number of psychiatric providers and improve our psychiatric infrastructure. In 2018, we started with a $900,000 budget allocation, and that has fluctuated between 500 and 600. Last year was a $600,000 request. This year, we're recommending decreasing the psychiatry supplemental to $400,000. That would, and what we're doing there is to incorporate the full cost of the medical director position, which is a full-time psychiatrist in the TRC, providing leadership. In the case of Dr. Thompson is now the medical director and the executive director. So we wanted to put the full cost of that on the TRC's budget and on the sales tax support versus splitting that support between property tax and sales tax. Sarah, do you have something? You look like you. Okay, and so that would be continuing to support the gap between revenue and expense for the psychiatry positions that we added at Burt Nash through this process, up to 40% of the overall total cost. So that would not exceed $320,000 in 2022. And then there would be an additional $80,000 available to provide, throughout the course of the last couple of years, as we've tried to improve and tweak and adjust as providers have come and gone, there have been some need for additional supplements. So for example, last year and the year before, Dr. Thompson was providing psychiatry services before he was the medical director and before he was involved with the TRC, specifically in the emergency department. We funded that with psychiatric supplemental funds. And those requests are requests that are vetted by the psychiatric infrastructure group, which now is both a group of sort of our agency partners management team, as well as the providers themselves. So that is kind of, I think, how we got through a process. That's a process that led to county funding the psychiatric resident clinical rotation in year 1, Burt Nash funding that in year 2. In year 3, we will fund that with sunflower dollars. So it's an example of how we use that psychiatric infrastructure supplemental to kind of incubate and catalyze projects so that they could, things that wouldn't happen without that type of catalytic support can get started. And then gradually we get to a point of sustainability that can be carried on the behavioral health projects budget. SUD programs, the Behavioral Health Leadership Coalition, there's a lot of energy around kind of doing what we did in the supportive housing space with regard to assessing the needs related to substance use disorders in Douglas County. And so we've been working to come forward to you with a proposal to kind of develop a comprehensive needs assessment for SUD. Again, synthesize all that data that we've gathered through KCTC, through focus groups and interviews and work that the health department has done. We think there's a need to put that together so that we could sort of better prioritize an objective related to SUD in the community health plan. Continuing to provide supplemental funds to reduce disparities and support SUD treatment for men and uninsured women. That is an increase over last year, but it's also kind of a consolidation and synthesis of putting dollars in one place so that they could be accessible by a variety of needs. And then
It's still mostly consolidated. There's still funds in drug court and behavioral health court. So I think that's something we've still got to kind of work through is how we sort of find those places.
And then continuing to support the expansion and implementation of smart recovery throughout Douglas County as the TRC comes online in community-based locations such as the TRC in library settings, in other places throughout the county. It's not new spending in terms of there's a training line in the behavioral health projects budget, and that's where those dollars would come from. So the new spending is taking the Engage Douglas County Prevention Coalition's allocation up to $20,000. Crisis and Recovery Center not to exceed $3.4 million on the sales tax in 2023. $750,000 continued to be sort of earmarked for mobile access and the crisis call center and linkage to 988. An expansion of intensive care coordination of about $100,000, SUD treatment for men. That's again, an increase from last year. Crisis involved youth services not to exceed $104,000.
And those are all built in, but Engage Douglas County. I don't have that built in.
So, okay,
I don't have that built in.
Okay.
We
I
ran
thought-
out of money.
what's that?
We ran out of money, I think. Yeah.
Okay.
It's on their list for them to consider. But
Okay.
I don't have it. built
Okay, so as I said, each of the partners that are linked to these requests and recommendations and what you have is here and available to speak.
Except DECA, which we can bring back at a later date if commissioners want. And then we also, we need to talk about Heartland Health's request too in this time frame. And theirs is a little bit different. It's not necessarily directly related to behavioral health.
And did you say that Heartland Radac is Heartland Radac's here?
Yeah.
I just, okay, she's here, yeah. And I just have a couple of questions and maybe a little more data around the expansion of services. I think intensive care coordination is very important, but we keep adding to it. Can you talk a little bit about the data that you have, that the 5 that we have so far is lowering, the amount of recidivism we have, or the number of, just give me some data that what we're doing so far is making a difference, or are we just continuing to add?
So to speak to the addition, I think.
And Stacy, can you yourself, since people listening online, thanks.
Hi. Stacy Cooper with Heartland Radac. I'm the Director of Care Coordination Services and Peer Mentor Services. Oh, there we go. I'll figure this out. Oh, okay, there we go. Thanks. All right, so to speak to the addition, I think the focus of adding the 6 is really to lean into the criminal justice population, to ensure that those justice involved individuals that are connecting within community corrections, the jail, court services, have the opportunity to work with our services. We know that this population has a lot of complex needs. There's a lot of mental health, substance use. So we want to utilize basically the entire contingent of care coordinators to be able to support that population. So we know that by adding a 6th, it's not just one of our team that's going to be supporting the volume that is going to be over there. It's going to be the entire team absorbing the potential volume. I think that, you know, the conversations that we've had with the different players like Pam and such, we really can see that that's going to give us a huge influx of folks that we're going to be able to serve. Speaking to some of the transition with the lower numbers, I think that we have some dynamics within the county. We have new players that are, you know, learning about how the service can be utilized. And I have a lot of confidence that we're getting ready to have an uptake. I think even in this month alone, we've already had a ginormous increase just with the LMH referrals that are coming through. But something that is, I think, expected to change really is the robust way we're going to integrate with the TRC. And I think that, you know, the work that I've already been doing with Santana and such, I think that we're going to find that, well, we know that all the individuals that access the TRC are eligible for our care coordination services. So the integration between the way that the crisis center is going to be set up in this community, in addition to the behavioral health folks that are also going to continue in some capacity to be engaging with LMH, some of the role that we're going to play with Bert Nash. I know that I think at the end of the day, all of these players are going to come together and we're going to really see how all the total contingent of 6 folks are going to be serving the population to ensure that people get the right services at the right time. You know, there's different dynamics related to wait lists. And that's part of the conversation that we're having with Bert Nash right now is how can we support these individuals while they're on the wait list for therapy to ensure that they get some of their needs met in that window of time. So, you know, that's, I think, some of the intentions and some of the work that I've been doing out there. And I hope to see those numbers increase with the collaborative efforts we're making with our partners. Does that help?
Yeah, I just want to make sure, I mean, in some ways as the TRC comes online, and part of the promise of the TRC was that it would lower our jail population, you know, and yet we're adding more staff. I can see adding more staff because the TRC is coming online and we want to make sure that we're meeting that need. But it seems like it would be gone from somewhere else. And so you're telling me that just the demand keeps rising and we keep needing to provide more and more services. And I'm kind of, maybe I'm being overly optimistic thinking that, you know, all these services that we're putting into the system will cause us to see a decline in some of the needs. But you're saying the demand just continues to rise.
Yeah, I have my opinions on that. I think that there's a lot of mental health crises post-pandemic. The impact that the pandemic has had on our culture and this community has, you know, it has some lasting impact. And I think the need for connection, the need for, you know, really the opportunity here. So I would love to be able to say that we're going to the need, but I don't know if we're out of that window yet.
And Commissioner Kelly, I would say that where you're seeing the decrease is the out-of-county prisoner housing in the sheriff's budget.
Okay.
That number is down about $1 million over the last 4 years.
Okay, but we didn't see a reduce in the budget request from the sheriff. So we actually had a request to increase.
Well, but I
budget.
reduced his base, so that's part of it. But yeah,
Mhm.
but
Well, what I was
Stacy?
going to say, go ahead.
Oh,
Commissioner.
I just had some questions about the way that you were discussing equity in your supplemental.
I'm
Rep-
sorry.
I have some questions about the way you were discussing equity efforts in your supplemental request
Oh.
form.
Okay.
It mentions that you're starting to collect some demographic data. One of the things that we've learned through the CJCC is that the number of folks of color who are participating in things like our behavioral health court and drug court is much lower than the representation within our criminal justice system. And so I know that you're an outside agency, you're getting those referrals, you're not contributing to that. But what we see is that we're seeing differential treatment for folks of color who are hopefully receiving services. So could you just tell me a bit more about how your agency is addressing issues of equity?
Well, one of the pieces for us is that we serve all. And if they're referred to us, we want to be able to serve them in ways that support access to care. And one of the ways in which we do that is, you know, utilizing barrier reduction funding to walk people into doors. As far as the equity components, I think we're really focused on ensuring that whatever their needs are, we're supporting them and walking alongside and accessing them. The data that we're collecting, it's really just the referral base that comes to us. But as it relates to ensuring, you know, our staff are equipped, informed, culturally competent, and having really directed conversations with our community partners to ensure that access to care exists. That's I think the best we can do. And in addition to just navigating, you know, the different needs of these individuals as they arise and ensuring access to care.
I also think if we look at the data, both from the care coordination project, because the data is really substantial that we get from them monthly, and the racial equity diversity breakdown in that data after your request is more substantial than it's been. The same is true at LMH with our ED data. And I think what you see in the community is that data shows that the need, right, is reflecting like what we're seeing in the jail. There's this disparity in the need, but at the same time, I think this team is addressing that need in terms of the number of referrals and the breakdown and the demographics of the people that are being served by this service and by ED visits and the team that's been working in the emergency department. So, you know, what I would say is I sit in both spaces, Criminal Justice Coordinating Council and the Behavioral Health Leadership Coalition, is I think we're doing a better job at providing more resource and actually supporting more people that in an aligned way to what we see in terms of the disparity of need. Does that make sense?
That makes sense. I think the big question for me is that we're seeing a disparity in need. We're not necessarily seeing access as far as referrals, but that's from a
But I'm
criminal
saying, I think if
system
you look at the
perspective.
ED data and the care coordination data, because I've looked at that, and that would be a question I want to toss back to the data sharing collaborative, maybe is something that we look at. My sense as I look at those numbers is that it is aligned with the need. And in different ways in terms of the disparities that we see in the jail, in terms of how people are getting services, how people are accessing services, how people are responding to an opportunity to engage with, you know, drug court, behavioral health court. These two things, I think, are meeting the increased in disparity better than we are in the criminal justice system.
It'd be a good thing to talk about this fall too. Pull those numbers out and bring the data sharing
Yeah.
collaborative.
Yeah, and I mean, I guess one point I would make is that the nice thing is the way in which the emergency department and the care coordination service is providing this data is it gives us opportunity actually to not just raise the question, but actually answer it.
Yeah. Other questions?
I don't have any other questions. Fellow commissioners. Okay. Thank you.
I want to have a conversation about Heartland real quick before we go. You and maybe Julie and Liz, if you want to come up, you can, and I can kind of explain what I sort of asked of Heartland as we approached this budget process was when I had my initial review with Heartland in April and May. You know, so much has changed in Heartland's financial picture over the last year or so that it became clear that the allocation of the county funding for an integrated care team really wasn't needed in the same way as it was in the past. And so I just sort of approached the conversation with Heartland and said, so let's talk about it. And the conversation came back around medication assisted treatment and dental. So I don't know if that's because I think I need some clarity as to what it is that we're funding in terms of our support for Heartland. So I thought maybe I'd give Julie and Liz a little bit of an opportunity to talk and then opportunity for commissioners to ask questions. You have to push the little button to green. There you go.
Oh, I have to say my name right. Elizabeth Keeper. Oh, man. So fancy. Elizabeth Keeper, Heartland Community Health Center. Thank you for letting us take the opportunity to revise our budget to more appropriately align with the county's strategic direction. And we think that there is a lot of potential when it comes to expanding our capacity and offsetting some of the costs that we're seeing related to medical assisted treatment, and frankly, what is seen as evidence-based best practices when it comes to integrating primary care dental along with receiving medical assisted treatment. We've known for many years that primary care integrated with medical assistant treatment is best practice. And new research has shown that when you add that element of dental care when it comes to medical treatment, medical assisted treatment, that you see even more success rates when it comes to completion of the program and ultimately employment and housing stabilization afterwards. You're seeing an 80% increase in completion of the program, and it would really help benefit the community as a whole. So we hold 10 spots available for DECA patients each week for medical assisted treatment programs. Last year alone, Heartland saw over 1,000 patients receiving medical assistant treatment. And unfortunately, due to the capacity that we have for dental programs, only 14% were able to receive the dental care. And then it also would help offset the cost of being able to have an additional allocation of MAT supply on hand for patients. So we don't have to wait for that prescription and that product to be refilled. That moment someone comes to us, that we can have that product available to them. In that supplemental sheet that I gave you, it shows a breakdown of the variety of potential costs associated with a person who is receiving medical assisted treatment with Heartland. So anything from a behavioral health appointment, 40%, as we know, of SED patients that we're seeing have chronic depression. So anything from behavioral health appointments to dental appointments, ranging from simple root canals to complete dentures. We've got a goal by 2023 to have the ability to do dentures in-house. So that will also be able to increase our capacity for someone who needs full reconstruction. One of the things that I think often is unseen is that a lot of the medicated assisted treatments absolutely destroy oral health. They're really difficult on teeth. I know Julie can speak a little bit more to it. And it really helps long-term when it comes to that treatment plan.
I don't personally have questions. Commissioner Portillo or Commissioner Kelly?
I just had a bit of a question that, you know, what you described, Liz, sounds great. That's awesome. I was a little more interested in talking about fund balance. You know, currently you have a $5.8 million fund balance, and I saw in your documentation that you said it is not unrestricted. Even though we ask you for unrestricted fund balance, you're telling us it's restricted. So I'd love to give you a chance to talk a little bit about that. I'm not sure, but this may be the highest fund balance we have of any of our community partners. And so just want to give you an opportunity to speak to that a little bit.
Sure. Julie Brandstrom, Heartland Community Health Center. You're right. We do have a healthy restricted or unrestricted fund balance. Best practice for an FQHC recommends 2 months of cash on hand, 2 months or 60 days cash on hand. And so of operating expenses. And so that is well within that guideline. In fact, we're not quite up to 60 days of cash on hand. It really is seen as a protection for the health center in the event of unexpected losses of providers. And so, you know, we're within the guideline of what we would need. It's an expensive operation to run. And so having cash in the bank is really important.
Yeah, it's just, I'm weighing sort of the funding that we provide to Heartland and the impact that our property taxes will have to the community as a whole, including many of your clients.
Mm-hmm.
And just when I see that high fund balance, you know, my question just sort of becomes like, how much do you need it? And that sounds a little bit crass, I guess, but I do think it's a question that I have. And I just want to give you a chance to respond to that. You know, because oftentimes with so many of these community partner requests, we renew them year after year after year. And we don't take a lot of time to say like, when could we scale back? And it seems to me like Heartland's done really well. You're acquiring a number of, you've added Panda, you've shown the number of patients that you're increased. So I just want to give you an opportunity to respond for that.
And I'm sure we can provide documentation of that best practice if that would help kind of address some of your concerns when it comes to that fund balance. And most certainly, we are aware of, the impact on property taxes. And but when it comes to this particular program, it supports collaborative partners across the whole spectrum of behavioral health and frankly, all of your funded partners. So we think it's a really important request and can most certainly provide documentation to support that need for that fund balance.
Back to the conversation about MAT, I guess I still would like a little, I think as we move to, if this is to proceed through the budget, as we move towards an agreement, $227,003 goes for, if I divide it by $2,156, the annual cost of a patient or what's my division? What's what are we getting? And I think, and I don't know that we need to do it right now, but I'm gonna need some more specificity in how we're tying that together.
Well, this is Commissioner Portillo. I think that Sarah's comment and Commissioner Kelly's comments are really important to bring together, because what it looks like is that traditionally we've just funded Heartland. And now with this project, we're saying we're not just giving a lump sum of money for Heartland operations. We're saying we're paying for a very specific thing, a very specific program that ties into our behavioral health goals. But is that true? I guess that's part of it of we are restructuring. Are we? Maybe that's the question. Are we restructuring the way that we've traditionally funded Heartland? I mean, last year we had some broader questions about our Heartland funding. I think there's been a lot of stabilization and leadership, and that's really fantastic. But it does seem like we're at the point where we may be saying our relationship with Heartland is shifting from just funding basic operations, which it doesn't look like there's a need for county money to do that, to county funds funding a very specific program that supports our overall behavioral health strategic goals. And can we structure the budget request and the way that we allocate the funding in that way?
I'd agree, Commissioner Portillo, with your explanation of how that is. The only caveat I'd say is that the initial funding for Heartland was originally a combination of healthcare access funds and Heartland funds, and it was dedicated towards, integrated primary care. So I don't think they could have used it to buy a new building, for example. So it was integrated for that, but that is a lot of their base operation. So, and as commissioners know, and most of these community partners in the room know, I am over time trying to gently, at the rate we can handle the disappointment, move base county community funding towards contracts for service where there's distinct deliverables that the county understands what is being provided and how is it being delivered, as opposed to just good people money. So this was an area that if we're going to move away from it being just good, and behavioral health partners have been really a space where we've done a lot of this. The DECA contract, the Burt Nash contract, all very aligned. It's very specific initiatives that we're trying, and that's how we're building the TRC operating agreement. So if that's the direction I'm headed, we can just keep it as good people money if that's where the commission's comfortable. But if not, I got to have it tied to something that we can get performance measures on it and that we can really hold folks accountable for.
I personally am a big fan of moving in that direction. I think it's just
When and how and what.
yes, those questions.
Yeah, and we can talk more about it in deliberations. I think we're headed in the right direction there. I just want to make sure that we're not saying, okay, we used to give you this much money. What can you come up with
I
for
hear
that
you.
much money? And so I just want to think a little bit about that. We have other groups that are coming up later that I think the same question is there, like exactly what service are you providing? And when I look at your balance sheet, I don't want to necessarily penalize success. That's not what we're trying to do. But we all have other organizations that either have no fund balance or would love to get towards best practice fund balance, and they're nowhere close. So I think what we want to do is build up those organizations so they can continue to provide that service as well. So it's just something to think about as we reposition our relationship with Heartland.
This is Commissioner Portillo, and I guess this may be a conversation for deliberations. I just think it's important to kind of state it here as well. I want us to be really careful not to punish organizations that are doing well and are doing best practices. I think for me, it's a fundamental shift of philosophy and funding, that it's not just lump sums for operations, but it's saying, what are county funds going towards? What are the data that we can use to show that these are good investments? And I want to invest in organizations that are doing well, not just invest in organizations that like desperately need our help. And so I think that that's, for me, it may not be about the fund balance of the organization. I think all organizations should get to the point where they're operating in best practices with their fund balances, which varies depending on types of nonprofits and types of organizations and things like that. But it's much more of a shift in philosophy of going from, we're just going to give a little bit of lump sum money to all of these organizations doing good work, to we are funding particular programs that align with our strategic vision as a community.
And I just really appreciate commissioners saying this, since we've got a lot of community partners in the room. When I have a lot of these difficult conversations with them throughout the year and in April and say like, we have to tie it to deliverables. It's, you know, this is really coming from the commission's direction in terms of how we want to structure our funding for community partners. So I appreciate that, commissioners, and we can continue to have a conversation. I think we can have that conversation on Monday as we start deliberations, but if Heartland, you guys want to do any work on that piece as to how we could do that in advance of Monday, that'd be great.
Yeah, and just to speak to that, the request was so we could, our revision was a flat request from previous. And if you look at the sheet that I provided you all, most certainly not every patient is going to experience the same care. So I could give you the total cost of what the program would be. And if you add up the total number of insured versus payer mix, it far, far exceeds the value of the programming. When you're looking at just dental and primary care, the value of it for just uninsured patients is 1.6 million. So 200,000 of helping offset our unreimbursable costs is really helpful, but also it helps with your conversation when it comes to making sure that we have a healthy fund balance and are continuing with best practices, but still using some of those funds from our fund balance to provide that additional care that isn't being offset by the county. So we're not asking for you all to provide 100% of this program and the care that we're providing, but help us offset some of those reimbursable expenses. I mean, the value of those 10 slots that we give to DECA each week is $77,000 a year for just that alone. So I think that it is for the amount of services that we provide and for the offset that we're asking for, I think that it is taken into consideration. So
I think that's helpful. I think if you can kind of structure that into something like a little written piece as to how that goes and your other payer sources, that might be helpful for our conversations Monday.
okay, great.
Any other questions from commissioners at this time? Okay, thank you all for joining us. Have a good rest of your day.
Take a small break while we move everybody, switch teams.
Sure.
Okay.
Sounds great.
Yep.
Oh, yes, you're right.
Group and you're correct here. I did try to break up some of our human service partners by other and I always sort of struggle with how to break these pieces up. So these are a variety of youth related sort of generalized at-risk youth conversations. We have supplemental requests this year for the Center for Supportive Communities and O'Connell Youth Shelter and Van Gogh, and they're all here today, as well as other partners in this space have been invited and are also attending. Commissioners, do you want to have a conversation about Truancy First and the Center for Supportive Communities project, or And then that might blend well to a conversation with O'Connell about their supplemental request and their funding. My thoughts on how to, but I'm open to ideas.
This Commissioner Reed, I think that makes sense. And I would love to hear from Pam about your office's interaction with and perspective about the truancy programs and what the potentially unmet needs are. Yeah, I'd just love to hear more from you about that to kick us off.
I'm Pam Weech, and I'm the Director of Criminal Justice Services. We're kind of in a different situation than we've ever been in terms of truancy. We had the luxury of having truancy run through KU since 1977. So we've been working with KU on the truancy aspect forever. And this year, we're kind of in a different situation because KU has decided to drop the KU program, which I think we talked about in the presentation earlier with the commission. We took over DCF, which was then SRS, used to be supervising the truancy program with KU for a number of years. And then I think it was 2006, and forgive me if I don't have the exact dates because all things run together for me at this point in my life. We had approached Craig at the time in the commission and said, you know, we feel like it's really important to continue to support the truancy program because DCF was no longer going to do it. And we felt like if we couldn't keep the kids out of the deep end of this ocean of criminal justice, and the best way to do that is to address truancy, because that was a big predictor of kids who are going to end up in the system because they're highly at risk. So my staff, Kate Holman, who's sitting here today, supervises the truancy students along with the staff at KU for the last years since 2006. And what happened was that the students would come in and talk about she assigned the youth that are assigned to truancy to those students, and then meets with the students and talks about any kind of behaviors they're seeing, or if they're any child needed care issues, and helps them make reports to DCF if there's concerns that need to be addressed further. So we've been doing that since 2006 to 2022. This year we were notified by KU that they were going to no longer have that program. Fortunately for us, Dr. Dockman has been with the KU truancy program, I think 8 years. Okay, it was longer. And so she took it upon herself to create this not-for-profit so that we could, because I still didn't want to drop the ball on these young kids, because we're serving really kids from kindergarten through middle school with her truancy program, and the shelter's truancy program, which I don't remember when the high school truancy program started. And I don't know if Gina, 2011, they started the high school truancy program. So, I mean, that actually came about because at the time we were actually seeing all the truancy students through the KU program, but then we didn't have enough practicum students to actually function. We didn't want kids on waiting lists. And so the shelter stepped up and said, we can do truancy for high school. I don't really remember all the details of that. So that's kind of how we came about having two different programs serving youth. And we kind of divided them up because the truancy students from kindergarten to 8th are a lot different than the high school truants. I mean, you're really addressing family issues versus kid issues. And so that's kind of how we, I think, established the division of how that was supervised. So Dr. Dockman and her partner had put together a proposal, at least on trying to sustain what we are used to having. I will say that in the past, we were funding the KU truancy program for the graduate teaching assistant through our KDOC grant to the tune of like $15,000. And then we were supplementing that because we weren't seeing any KDOC increases in that fund. So we were supplementing it to the tune of about $3,000. So I'd say the whole support for the program was about $18,000. 15 of that was from the state and 3,000 was from the county. And then we also provided some incentives. We were providing gas cards for the interns to help offset the cost of transporting truant students and also just visiting with students in the field or at school or at home. And then the district attorney Branson was providing some gift cards for students. We were doing some gift cards for students for incentives for compliance and attendance in school. We were trying to encourage kids. And so we actually even created a game closet of things because a lot of KU students aren't going to be bringing things that would be entertaining for kids to college. We created kind of a game closet of things that they could check out and work with the kids in the free time when they were done with their studies. So that was kind of that's sort of the history in a nutshell.
Thanks, Pam. And so when it's split to the two different age groups, I guess for your offices, for Kate, did the process in terms of supervision of those mentors, did it change a lot? Were there any challenges that were presented by having two different programs that youth services was?
I wouldn't say there were really any challenges. They're
Okay.
just a lot different. Now we see a lot of the high school truancy students in day school because the court uses a remedy to contempt for not attending school as ordered is to attend day school. And so we do have a number of truancy students that are also supervised by the shelter, the O'Connell Youth Shelter, that are in day school. I don't know what percentage of their students are in day school. I just know we have a number of them year to year that we supervise in day school.
So they're truant and in day school?
They're in day school because of the truancy.
Okay, so but then they're covered both by O'Connell and day school in terms of services.
Yeah, I mean, we don't have really, if we had a truancy student that was our truancy student, we would transport and stuff if they missed school or something. We don't do that. We contact the shelter if they're missing from school.
Okay.
So we do sometimes have youth who are truant who still continue to be truant.
Okay,
I mean, then they generally go back to court. I mean, then the children's shelter would file an affidavit saying this person's not attending and then bring it back to court and let the court decide what they want to do.
okay.
So the process is very similar on both sides. We both have hearings with the assistant district attorney on in terms of like graduations and or violations, and then talk about if we need to file or not file or whatever. So they're really similar, although they're kind of detached. And hopefully I'm saying that correctly.
So I appreciate that question, Commissioner Reed, because that's where I was sort of headed. Like, I think we have a unique opportunity here and one I'm pretty excited about to look at truancy services because we're coming out of the pandemic and all the information that was given to us by the two organizations was we really saw all kinds of nutty things happening during the pandemic when it came to truancy in schools. We're responding to that. And the history that you gave us sort of says like, well, we just didn't have enough people to do anything beyond middle school. So that's when the shelter stepped in. So I'm going to ask you to sort of, if you could sort of erase the whiteboard and start again, what would that system look like? You know, I mean, one person might envision a system where dollars were provided to criminal justice services, and then they worked with these partners to based on the number of clients they served. Right. I mean, that would be one way to do it. And that we might fund those organizations on a prevention side. I'm not saying that's the best way. I'm just asking you if, because you deal with so many of those kids coming into your system, is there a way you might think about that?
It's Ms. Pam Weegan again. That's an interesting question. I mean, I've always liked the Minty focus of the younger truancy program. I think it's really important for young people to see young people encouraging education and engagement. I think it's always hard when you have somebody my age trying to encourage a kid to go to school. We don't really relate, and they don't really relate to me. I'm a little old. It's more like grandma saying go to school. But that's probably my bias. We've had a lot of people come in over the years and talk to us about our truancy. There are lots of agencies across the state say, I wish we had what you have because we don't have these resources. That's the one thing about Douglas County that's incredible to work in, is we're so resource rich in terms of all the programs that we have available to help getting kids engaged and hopefully reduce their risk to offend. So, I mean, I just like the mentee part of it, but I really have never thought about what I would do if I was starting over. That's an interesting question. I'm not sure I can answer it right off the top of my head.
I guess I wonder, and this is Commissioner Reed again. I'm with two programs, I'm really interested in the continuity, and I've heard you say, and we heard in our work session a few weeks back now with the two programs. I'm interested in continuity of services, and I understand that there are differences because of different age groups. But it's important to me that those services across the board are taking into consideration the same sort of best practices and trauma-informed methods of delivering those services. So I guess I just want to hear from you a little bit if there are any, I mean, I understand, well, maybe you can help flesh out some of the fundamental differences that you see between what the needs and services for high school age students are versus the younger students. And if you believe that those differences are compelling enough to have two different programs versus maybe a consolidated program with increased capacity that has the same type of service delivery, same evidence-based practices, and maybe maybe there aren't really that many differences between the delivering of services and the framing of how those services are created, but this is becoming long-winded, which is sort of par for the course for me, Pam. Sorry, I think out loud. But if you heard a question in there that you've got a response to, let me know, or I can clarify more if you want. Thank you, everybody, for your patience.
Commissioner Reed, I think I grasped kind of what you're looking for. This is Pam Weegan again. I think we've never been asked to actually see how they could be more aligned. Which is an interesting aspect. I do think there's some difference in terms of a high school student is really responsible for getting themselves to school versus a young child who's really reliant on their parent. And so you're not just engaging the student, you're engaging the parent and the family in terms of solving the issue, whatever that might be. So I think there are some differences. Do I think that they could be aligned more? Probably. Dr. Dockman's proposed some things we've never had before with the KU Trinity, with behavior contracts and things like that, which I'm kind of excited about. But I think there's some opportunity for us to talk about how we can engage and align ourselves, so we're all doing kind of singing off the same sheet of music, and that, you know, the expectations are similar. I think, you know, and they might be. I don't know that we've actually ever looked at it. Like, I'm not as closely aligned with the shelters program. That doesn't mean that there isn't, I mean, I'm sure there's some great things about it. It doesn't mean that we're not more aligned. We may be more aligned than we realize, if that makes sense.
Not in my overwhelming desire to try to solve problems for the commission as we approach this. What I'm hearing in this conversation and what I hear when we had the work session earlier is that there's some real work that we want to see happen in this space to get at maybe what is a model look like? Where is integration appropriate? Where is integration not appropriate, but continuity of communication is? How does criminal justice services work in that space as our sort of staff, the staff department that's closest to it? And, one of the things I was thinking moving into this was, the commission could set dollars aside in the budget so that we could move past having to make those decisions within the next week or so, but continue to work this fall to really have more conversations about, what are the goals that we're trying to achieve? Are we collecting the right data? Do I need to write that into your community partner agreements so that you're collecting the right data so that we can report out? And we can report to not only, the Criminal Justice Coordinating Council and the County Commission, but also the Behavioral Health Leadership Coalition. What are we doing in this space? Because I do think this program is incredibly important towards working upstream. And I don't know that we've really spent the time and energy to really be as deliberate about it as we should. How do we need to make sure we're engaging other school districts in Douglas County besides USD 497? So how does that feel to commissioners? And I guess, we could ask, Centers for Supportive Communities in O'Connell some responses to that about, what if we put together a small little work group to continue to explore these projects this fall, putting money aside to be able to implement something, in 2023, once we've done a little more work on it.
I like this as Commissioner Portillo. I like this plan. My only question about the timing piece of this is that KU said that they're defunding, I assume starting this academic year. We're really looking at a budget for
It's July 1.
2023. Yeah,
Happened.
yeah. So the KU funds are gone.
Mm-hmm.
We're obviously talking about our 2023 budget. So this is not necessarily we can solve this problem with this discussion. But what's going to happen in the fall?
Well, at this point, we have the prevention grant, the 15,000 is moved over to supported communities for the fall, but that's $15,000. So that's not a great deal of funding. I think both the young person's truancy and the high school truancy already have clients in the pipeline that urge transfers over from the previous school year. We're also going to be inundated with folks that during the pandemic, they didn't know how to classify them as truant, but were definitely not engaged. So I think we may be inundated with more students needing support in this coming year than we've ever seen. And I may be wrong in that prediction, but I think a lot of the students weren't classified as truant because they didn't really know what to do with it during the pandemic. And now that we're kind of hopefully through it, I think we're going to have a lot more students identified as still not engaged.
Commissioners, would be okay if we asked O'Connell and
Yeah.
Center for Supportive Communities to come
Yeah,
up.
if you guys both want to
sort
come
of
on up,
talking
that'd be
about
great.
them while they're in the room.
But I only probably have room for like 2 people. So I don't know that I have room for 6. Yeah, I'm sure you would. Oh, you can sit right there. Great. Yeah. Yeah, come on up. I know we make you all real nervous when we make you sit out there and wait, right?
So I would really like to hear the answer to Commissioner Portillo's question for our Center for Supportive Communities, because that is a concern of mine as funding goes away. What do we do immediately? Because putting my educator hat on here, you're right. We've got some real truancy issues that are happening coming out of the pandemic that if we don't deal with now, come January, we can't reverse it. We can't just rewind the tape. So.
Hi, I'm Dr. Dockman. So luckily, the main thing that changed, luckily, was our funding source, right? So our program is still ready to operate. We've been able to get volunteers. We have right now 6 secured, plus we have practicum students from the University of Kansas. And then we also have interns who are wanting fieldwork supervision. So we have the people to implement the program, and they will be on a volunteer basis. We have received funding, as Pam said, from Kansas Department of Corrections. We've also received funding from AmeriCorps Kansas, and so that will kick into effect in, I believe, late August. So that will help us out as well as we kind of try to get more funding. We've submitted a grant to Kauffman Foundation. We've submitted one to Shoemaker Foundation. We've submitted one We submitted $1 million grant to Office of Juvenile Justice and Delinquency Prevention. So we're just kind of in that place where we're just waiting to hear what their decision is.
Okay, but what I'm hearing is that there won't be a lull in practicum students or interns who already are in the pipeline for continuing this work. We just need to figure out the long-term sustainability piece. Thank you.
What do you guys think of my idea?
Yep, that was just gonna
Of
bring that back to the surface.
Continuing to sort of talk about this fall to sort of, bring to answer some of the commissioners' questions, in terms of integration and so forth. Communication.
I think we have two really helpful programs, but I think we have two completely different models. Our program is more intervention based. The mentoring is important. We do assessments, we do treatment. When we're working with truant kids, yes, the referral is for truancy, but you have to understand all of the different factors that are contributing to a child's truancy. So when I'm working with them, I'm not just getting them to school, I'm doing parent training, I'm helping the teachers, I'm setting up routines in the house, I'm doing other things like that. We're also getting them access to community resources because a lot of these kids don't have access to transportation that they need. So in terms of moving forward, I guess my question would be, what would that look like? So would we continue to operate in the fall while these conversations are going on? Because ideally, we wouldn't stop services because
Yeah, I don't think anyone necessarily is thinking you'd stop services. And when we say, and I don't know that I'm envisioning, the commissions, that you would all have the exact same program, because what we've acknowledged that different, older kids have different issues than younger kids. So but what is the data that we're going to collect? How are we going to report that? How do we codify practice and process in terms of communication as a kid transitions? How is the communication work with Pam and that team and day school and the court? Just things that you probably have already always done in some ways, but probably should be put down on paper into some process. Those are some of the things I think could be really helpful, as well as a little bit of, are the programs really working? If you had a magic wand, are you doing everything you want to be doing in terms of this program? Because I think what you're hearing is a commission that's incredibly supportive of work in this space. Is that I want to make sure I did not misstate what my commission thinks.
This is Commissioner Portillo. I don't think you misstated anything. And I think we did this last year when we were talking about public defense, where we said, we know that we're going to fund something. We're going to set aside some funding, bring everyone to the table so that we can continue to have the conversations around implementation and then move it forward. But we're not going to say, here's exactly how funding is allocated right now, because we need to figure out the broader strategy. And so that's what I'm envisioning, that it's a very similar process that I would be supportive of, but I want to make sure that's consistent.
Gina, I'll let you jump in here in just a second, but let me just say, I agree with Commissioner Portillo on that. I think we have more partners that need to be at the table here. We need to have school districts engaged in this so that we definitely need to have the courts here, because we use day schools sometimes as the hammer, on kids who just will not attend. I do think that the programs are different and probably should be different. There's just a different thing that happens at high schools when kids go from class to class. There's lots of opportunities to find your way to Panera rather than to class. And in some ways, O'Connell is better suited for that because of their engagement as a group home as well. Those are different services, but sometimes they overlap. So I just think there's lots of things that we need to talk about. So what Commissioner Portillo is saying and what Sarah is saying is the same. I don't expect that services will discontinue in that meantime. But we need to have a conversation about how we make sure that if you don't get those grant fundings, you can still stay operational. So I want to let Gina jump in here.
Hi, Gina Meyer Hummel. I'm the executive director at O'Connell Children's Shelter. And I kind of want to go back a little bit because Pam and I have operated in this space for a really, really long time together. So I actually remember and worked as a social worker when we had truancy within the DCF office. And so I want to kind of to your question about the whiteboard, and then kind of looking at truancy overall, what happens in our state. I mean, again, I talked about this earlier. We're absolutely blessed to be able to offer prevention and truancy programming because across the state, as you know, kids are coming into state custody for truancy. So we definitely want to fund and do something. I would tell you, and I think there's a little bit of a misconception that I want to make sure that you all are clear about. O'Connell Children's Shelter, with the combination of both O'Connell Youth Ranch and the Children's Shelter, we are situated to be able to provide prevention-oriented services for our community. We do now have staff who go into families' homes. We do offer, you know, all kinds of trauma-informed care programming. We do offer evidence-based programming. We are a major contractor for our state. So I want to make sure that you know, truancy aside, which is a really incredible, important part of what we do, past that, we have all kinds of evidence-based programming that we send people into our home. And it is one of our primary functions. It is, in fact, the reason why the Children's Shelter came into existence, to provide prevention-oriented services for our local need. And so I don't know how I can stress that enough, that we at least primarily have existed to take care of our local families. And really, I would probably throw something out, which is probably without much funding, we would work to take care of young people too. I mean, we'd have to obviously tweak our programming. There are a lot of differences, and I certainly want to figure out how we can incorporate all the great things that KU has done. I am relatively new back into my position with O'Connell Children's Shelter when this whole kind of conversation was happening and KU's programming was going away. And I think if I'd have been paying attention, I would have probably inserted myself into the conversation then, because I think we really want to be part of this conversation and really want to figure out how to your point, operate in a way that makes sense and as supportive. So I think there's absolutely a way to operate and take care of our grade schoolers and middle schoolers in one way. I mean, and maybe we have to tweak the programming, and maybe we, you know, so I would just say that I think we are situated. I know you want to fund other nonprofits or whatever, but I think we're situated where with not much tweaking of our program, we can also, if we had to, pick up doing and taking care of the younger people as well. So that may not be what you want to hear, but I want you to know that we are committed to taking care of families in our community and growing in that way and taking care of families in that way. So to your point, if you want us to report on specific things, if you want us to work in partnership with folks, absolutely. I mean, we are just absolutely committed to working in this part of our system.
This Commissioner Reed, I just want to reiterate what my fellow commissioner said and affirm Sarah's thought that I do think this needs some more in-depth discussion and a little bit of analysis. And so I like the idea of probably setting aside some funds, because it's clear to me from this conversation and our previous conversations that the commission as a whole is really supportive. But as with all things, it's also really important to this commission to know what the investment is going towards, and to know that it is going as far as it can go, and that it's also happening in a collaborative way. And so I think that this particular moment in time, with the change of how services have been historically delivered and divided in our county, is the opportunity for us to help strengthen a good foundation of regular communication and collaborative work to just assess programs across the board, how they're functioning and where they've been and where you all each hope to go. And I think together along with the school districts and maybe some other partners too, like the court certainly, to be able to identify any particular gaps or red flags about things that maybe have not been addressed in recent years, just for lack of not really knowing because we haven't been assessing. And the fact that the last 2 years in the pandemic has created all this additional, I mean, it's just, it's a pressure cooker situation. So I feel like that part of our opportunity as a commission is the power to convene and to really help drive some conversation in a direction that is intentional and thoughtful. And I appreciate Commissioner Portillo asking directly, like, what will happen this fall, because these requests are for 2023 funding, knowing that and KU, it sounds like sort of pulling the rug out from under you a little bit without much notice. So anyway, I just really support the idea that we continue this conversation and we try and figure out how to frame it and kind of workshop it this fall beyond a very busy summer budget.
Yeah.
Double duty season on the heels
Yeah.
of ARPA too.
And I get some of the complexity and I think, I hope, both of you all are hearing that the commission wants more work in the space. If I'm not clear on the high school, like, are there other dollars you're bringing to the table from other funders for truancy? That's not in the packet, so I think some of those pieces in terms of, trying to make sure we have a very clear understanding. What, if you had more, what could you do? Both of you, I think some of those conversations, we need more work here. And so I just think it's, in my view, it's not going to get solved at this table today or next week. It's a conversation for just continuing those conversations, just to try to bring something better, a little more refined back to the commission. That fair?
This is Gina. I would just answer that both agencies combined, of course, have existed in Douglas County for a long time and have fundraised privately to offset all programming and all funding losses for years. To the tunes of hundreds of thousands of dollars. So
But you guys also have state funding too. So that's where I'm
but-
not
but
always real
that-
clear.
The state funding, again, we wouldn't privately fundraise if it often covered all of our
Yeah,
expenses.
sure.
So, yeah, to your point, we bring in $100,000 privately fundraised to offset all of our programming.
Yeah, I just want to clarify something. I think I heard Sarah say, what you're doing now is not bad, right? It's not. And I will say, some of the documentation we got was fabulous. I want to use that as an example for other groups. Like, this is what I'm looking for when we ask for budget requests. The depth of it was really excellent. I think what in many spaces over the years, the county commission has worked to convene groups that are working in a similar space for coordinated activities. So when you think about behavioral health, and I know some of you here were sitting in on that, where we are today is because some of that great work that's been done with those groups working together and saying, oh, you're doing this. I think what you're doing, you're really situated really well for doing that. So maybe you could do that for this group and I can do that for this group. And so that we're not doubling up on services, we're not doubling up on data collection. And we're just being really thoughtful about how all those organizations work together. When I came on the commission, Behavioral Health Leadership Coalition had already been meeting around that idea, but we've also seen that happening in our human services sector, criminal justice services as well. There's a number of sectors that we really have put some energy in. That doesn't mean that whatever anybody is doing is wrong.
Right.
It just means we can learn from each other. We can take the benefit of intersecting and understanding and getting better data collection, because in the end, we don't have time to talk about this today. What I want to hear is, based on these services, what are the outcomes that we expect to see based on these services? And how are those funds related? And if we're setting a rate that we're going to do it, then if we have a request for more dollars, we're not reaching it, or that we think we can do more with more dollars. And that's just it's a long-term culture shift, but you heard Sarah use the phrase good people money. We need to get towards outcomes as clear as we can. So this isn't to say that the services that are being provided or been proposed here are not good. It is more of a discussion of how can we collaboratively work together to make it even better than what it is now, and be a good steward of taxpayer dollars towards those outcomes.
So, and that might be a decent transition into conversations about, we had conversations, DECA was not able to be here today about youth crisis beds. I think that's also an area where I think we just need to have more conversation. And I'd really like to hear from Pam's team, what are all the different various scenarios which youth are taken or voluntarily choose to leave the home? And what does that look like? What's the state's responsibility in that mix? What is envisioned out of the folks at the Treatment Recovery Center in terms of the access center and youth in that space? So, what we talked about was trying to have another conversation this fall, a little work group around youth crisis. And I think that's going to, frankly, could be a much larger conversation as I look to Bob Tryansky here about that. But I think just some initial conversations as to how we're going to work in this space. We've known as we've done this work that youth mental health issues really just, the 20,000 pound gorilla in the room. Yeah. And so, and we need to spend time and attention in this space. As a community, not just the county, not just community partners. So I think this would be the start of that conversation coming off of the opening of the Treatment Recovery Center. Does that sound like something that we could, work to pull together conversations this fall around youth crisis and those supports?
Any other questions? I really like this conversation and appreciate where it's gone. Appreciate each of you for continuing to participate in this with us and hopefully being some leaders in how we move forward a good continuity of services and collaborative work around youth crisis. And to Sarah's point, it has sort of been a gorilla or elephant in the room that we've supported some services around, but not necessarily cohesively. And I just think this is our opportunity to put all those cards on the table, so to speak, and really figure out what's working, what may not be working, and what opportunities are in front of us. So thanks all for your time. Have a good rest of your day. Pam, you have
Can I
something
just ask,
to finish?
this is Pam Weegin again. As a follow-up, do you want us to have a study session with the commission and
Yeah,
is
let's
the
talk.
goal like November, October? What do you think?
Yeah, Pam, I'm open to some ideas as to how to approach it. I think it's more than just a study session. I think what I'd like to see is a kind of a project plan in terms of how are we gonna, work together in the space. And then if there are specific questions you need, advice you need from the commission, we can certainly get that. But, how are we going to gauge what the school districts are thinking? How are we going to gauge where the court's at? How do we break down both programs? And then, yeah, I'd say something this fall, but I think there's a lot of work in advance of that. Does that make sense? Because I want to make sure, I don't want folks to feel like we don't have clarity.
This is Dr. Ackerman. I'm still a little bit confused about what the funding plan is for
Oh, gee.
moving
Yeah, I know. Isn't that
forward.
always nice?
Because
Yeah.
I have to make some pretty important decisions coming up.
Yeah.
And I don't know that that I will continue in this role if I don't have funding to have support, because it's not sustainable what I'm doing now.
So generally what happens is the commission will meet next Monday and Tuesday in deliberations and make some decisions in terms of how to approach that. I think what I heard earlier is that there are at least a couple commissioners that are supportive of setting additional funds aside for this work. We've in the past held them so it doesn't necessarily go on a line that says Center for Supportive Communities yet. but it's held so that it's available. And then once we get the plan, a plan together, then we can make sure it is allocated for 2023, if that's the direction the commission wants to go in. So I wouldn't want you to feel like we're going to do all this work and not be able to have funds aside. I think, but those are decisions the commission will make next week. Does that help you a little bit to understand and in terms of approach? And that's, I can talk to Pam a little bit about it too. We've done this quite a bit. I mean, we can set the funds aside, but we don't want to necessarily say, go to town, see you next year just yet, in terms of how the programs are structured. I know it's making you nervous. I get it.
I'm just,
Hold on.
so
yeah.
do I plan to continue operating? Or are you wanting the programs to stop and then have a conversation about how it should move forward? Or are you wanting it to continue?
The plan is to continue and have the conversation in the fall about how do we have a long-term strategy. So continuing in the short term and have that work group session in the fall with funds, like Sarah mentioned, set aside but not allocated until that longer term conversation happens. Potentially, we still have to do deliberations next week. But the goal is to continue. That's why we started the conversation with what happens this fall, given that KU has already pulled their funding. And it's great to hear that there are already folks in the pipeline to continue the work this fall. The conversations this fall will be about long-term planning.
I know it's hard to wait till next week, but I think our deliberations will help some more clarity on that. Just as a process, because today we're just sort of asking questions and then we'll actually put dollars to things and it will probably become a little more clear. Yeah.
All right, thank you all for your time. Have a good rest of your day.
Bingo is here if there are any questions related to their supplemental. I don't know if commissioners have any questions related to them. If not, okay. Thanks for coming, Melanie. All right. I think we'd like to take a quick break. Do you want to take a quick break? Maybe 5 minutes, and then we'll get started on our safety net human service partners. These are represent some of our safety net and human service partner providers. We had supplemental requests this year from the Housing Authority, JAAA, the Community Shelter, Trinity and Home Care, and tenants to homeowners, and then Housing First and Housing Stabilization Collaborative. SRC also had a supplemental request. It was funded through ARPA. So thanks for being here. Oh, well, last night, so that was asked for in both places and was funded there. I don't know how commissioners would like to begin to have conversations about, we've got normally I have a good theme and I'm able to kind of make it work. I do think there are some conversations around the landlord tenant program and then tenants to homeowners. So maybe, maybe we could start with Trinity and JAAA. I know we had a conversation about medically frail seniors. I don't know if commissioners have any other questions about the Project Lively request, and then maybe we can let Susan off the hook if she's not feeling well.
This Commissioner Reed, I personally don't have any questions for JAAA.
In terms of
Other
Project Lively.
commissioners or Project Lively.
Okay.
yeah, sorry.
Great.
So thanks for joining us, Susan. I mean, you're welcome to stick around for the conversation, but we don't have any questions for you.
Great. So wherever commissioners want to start is great.
Thoughts, ideas, preferences?
I'd like to hear a little bit more about Trinity and Home Care, not Trinity and Home Care, sorry, about from tenants to homeowners, a little bit about that program. You had a good in your packet, but we approved a whole lot more supportive housing and affordable housing, and just sort of how, since this is a new request and a new partnership request, if you could just give us a few more details on that.
Is that good? Yeah, thank you, Commissioner. Clearly, we're trying to grow our supportive service housing supply. And as I think we all know, often it's easier to get the dollars for the actual building of it. And we're bringing in a lot of leverage funds, including the generous support from the county. But the reality is, to make those really successful, we need to have the staff and administrative capacity growth to do it well. Part of that, you say 50 new units, part of that is the collaborations with additional partners like DECA, like Senior Resource Center, like, really O'Connell Youth Shelter for some of the foster care. Willow is a huge partner in DV survivor housing. And so we're really trying to build those partnerships so that we're not recreating the wheel of support wraparound services that other agencies provide, but that still requires additional staff to have those conversations with those agencies, to collaborate with those agencies, and to have someone who gets the call, because as a rental manager, trauma-informed rental manager, we're usually the first to get the call, right? Of a crisis or a trauma, or we know, for example, a subsidized rent is not being paid. What's going on there, right? And before it gets to the point that we're several months behind, we want to, rally the team and find out what's going on. So much of that is just staff time. And that's what we're asking for. That 100,000 would allow us to hire an additional staff. And I think the other thing is, as we're growing this, we will have proceeds per se from rental income. Now it's much less because it's subsidized supportive housing. But if we have the funds to build those units and we don't have mortgages on them, we have insurance and rental maintenance costs. So 100 or 2 of that can go to supporting that administrative staff as well. So we pencil that very sustainably. The reality is, just with supportive service housing, you can't have as high a rents. Now, the other partners where we would be working with could be housing authority, that they bring a voucher to the rent, or any number of other subsidies for affordable housing. If they're in trouble a month or two, HSC could be part of that, so that we're getting that sustainable support. But that 100,000 is really saying, hey, I said 92 houses. Now they're not supportive service housing
in the biggest definition, but I looked at how many units we have right now that have targeted populations that need some additional supports to stay housed. So seniors, and those, not all of our seniors need additional supports, but when they hit that age where they become frail and elderly, and I have one this week with dementia has hit, and she can't interact with us in the same way. So our staff, our supportive housing staff person is working with her family to get her to the assisted living she needs to be at, versus her falling in a unit at another rental managed unit that isn't looking at that stuff. So that's a really good example of kind of the once in a while, it's going to happen with seniors, but it's not all units have that issue, but it grows as they age, right? And so we're looking at, we have 48 units of senior housing. There's going to always be 5 or 10 that are in that process that need that supportive service. And I think it really, I love that you guys truly understand that we're going to pay for it somewhere else. Let's do it in a sensible way that causes the least trauma and gets them to the assisted living or the right size housing that they need in any given circumstance. So I think some of that's just being really proactive and upstream about how we manage affordable housing. Did you have a even more specific question?
Yeah, that was a
Patrick?
great overview. I appreciate that. And so you're talking about supportive housing, and I'm interested in, I think you still get funds from the affordable housing tax that comes to the city. Are you drawing a line between supportive housing as that being the county's responsibility and affordable housing? And there's overlaps. I'm not going to pretend there's not overlaps, but is that where you're seeing the difference in the asks?
That is what I have heard from you all that you want to focus on. The need is great across the spectrum. We could throw much more money at all of those things, right? So I have no doubt, but my affordable workforce housing for home ownership comes from those other resources. So this money will only be focused on supportive service, safety net for our most vulnerable housing populations. And often the units that are in the program, DV, survivor housing, kids aging out of foster care. And we're working with DECA to provide those units for people in treatment. So there's some other targeted groups that we haven't worked with yet that is part of that ask to grow these programs as we grow those units. There will definitely be more need. I think LGBTQ, there's definitely some supportive service housing that is needed for that population. And I'm talking to a bunch of people and very interested in looking at, could there be a safe place at some units that we could create for them? So these are all things, and your support on operating allows us to, and staffing allows us to keep exploring that and really trying to meet the gap needs.
Thanks, that's helpful for me.
So I'm sorry. So so with ARPA, you're bringing more supportive housing units online. Do you feel like, I'm trying to think about how we structure like your agreement with us. I don't necessarily want to tie it to just 92 units. So can you talk a little bit about that? We've sort of tried to talk about how do we transition from a community partner request into more of an agreement that gives you some flexibility to provide the support you need in a way you need it, but isn't just so like, whatever, do whatever,
Sure,
so
sure.
how have you had some thoughts about how we could document that?
This request is for the administrative capacity that we're imagining will grow with those additional 60 units that we asked for. I think 60 was what I'm sorry, there's too many numbers in my head right now, but somewhere around 60 to 70 that the ARPA funds will generously support building and acquiring the land for. So now to say those will all be done in a year is ridiculous. We all know that won't be the case. But planning for the supportive services and getting the collaborations together and working on program agreements and even just program creating the program, continuing to create the program of best practices and how we manage those supportive service housing units. So I think of the 92 we have now as not as pilots, they're doing well, but some of those, like we have 3 units of aging out of foster care. There's a lot of room to grow there, not only in additional units, but in learning what the best collaboration with. Right now we're working Willow and we are working with O'Connell Children's Shelter to look at a program where we're doing independent living skill training before they age out, so that we're building this stream to go then into these transitional units. So it's not like, oh, now you get someone who has no independent living skills, but is expected to independently live suddenly. Which is, of course, would be better on us to have some kind of building up. And so that's being done right now in meetings and program design to really create so that if we have another house for girls, for example, which I'm hoping we can, and that would be a good example of some of those units that we could build, that we say, okay, these 3 units will be for girls aging out of the foster care system. And we now have this program and these collaborations and people that are ready to go. So I do really feel like, we can talk about continuing to build programming while we're designing and developing these additional 60 to 70 units, and that administrative capacity, we're not going to come back to ask for more administration before those are fully completed. And honestly, I think that amount will help us even after those are completed be sufficient enough, because again, once they're completed, we also have program money coming in.
This Commissioner Reed. Thank you, Rebecca, for that overview. I have 2 different questions. The first one is, can you just give us nuts and bolts, like what your staffing looks like right now, about how many people you've got, which I believe has grown in recent years with more supportive housing coming online. And now you're talking about not quite doubling, but getting close to doubling the amount of those units, plus other projects and non-supportive housing that you might have in the pipeline. So we just talked to me about like number of staff that you have now and how many of those folks are dedicated to the supportive housing projects that are in place and that you currently have, and just a little bit of math about how many more staff you think you're going to need to support. And I know a lot of those are moving targets, so I'm not asking for exact numbers, and I heard you say that you're planning to tap into more of those partnerships where there would be different supports provided by different community partners. But we just talked to me a bit about staffing.
Sure. We have 1 full-time staff person right now who is dealing with any supportive service housing issues. That will not be enough for the additional units. There's no question. So I want 2 or 3 full-time. The $100,000 request would cover 1 or 2 people. I expect that I can get additional funding to leverage for 1 of those, so that 50,000 could go to 1 of those full-time staff, so that we're double or tripling our staff that just works with the trauma issues and the collaborations. And so, yeah, thinking they're not going to answer every trauma thing that comes up, but they are going to be involved in making sure the collaboration is working. So that's a lot of staff time, and there's no question that we need more. Right now, that 1 person is addressing the issues that come up with our 92 units. But we also have full-time rental maintenance. So rental management. So they also do leases and program agreements and administration of that. So really, right now there's 2 full-time that are dealing with kind of, 1 is administration and 1 is kind of trauma-informed, working with residents. And we are online to add another rental manager already outside of this funding. So we will have, so I'm hoping to have 4 full-time staff that are doing administration and supportive service housing provision. But we'll probably need an additional person once we start building those additional units. And I have no doubt that program funds and other funds can make that happen. So then, goal kind of within a year or 2 is,
to have, 5 people that are focused on that. And then we have 3 people in maintenance staff, and we will definitely need to grow that. And I have additional funds to grow that. So I'm hoping before the end of this year, we would have 5 maintenance staff.
Thank you.
And given that those won't come on all at once
Sure.
at 50, I think we'll be able to handle
stagger.
that, but also know that, we're setting aside money from our current rental program funds to grow that, to have kind of sustainable growth resources to do that.
Thank you. My other question is a broader, just sort of agency policy question. I've raised this with you before in previous conversations and work sessions. Talk to me, well, you certainly speak about, low barrier models to access housing, and then that trauma-informed, more supportive rental management. And I know that your sort of portfolio represents a wide spectrum of different types of housing and levels of support. Talk to me about and I'm going to point out one more thing. Heard you talk about possibly partnering with DECA to bring some units online that would be specifically help address the barrier that so many folks who are experiencing substance use disorders and have been criminalized for that and can't access housing because of their criminal records, specifically related to drug charges. I want to know policy-wise and practice-wise what tends to homeowners. Sorry, I'm not forming my question very well. I guess I want to know if you still have housing that is inaccessible by people with criminal histories. And
Our
if you've
regular
progressed
housing,
that at
our
all.
regular housing has barriers there because they don't have supportive services or don't require someone to have other collaborative case managers. And we have found that we can't handle all of that. However, our supportive service housing, the DV survivors, and we are right now in the process of making that barrier even lower than it has been, which puts a time limit of 10 or 15 years. We're discussing that, and we're looking at best practices across the country on that to lower that barrier where there really is, and it has to be a very specific violent felony to be not allowed, and case by case basis that we can look at that. So that is a huge lowering of the barriers that we haven't had before, that because of the work we're doing right now with DV survivors, potentially with DECA, that, yeah, we're having that conversation and have implemented, at least where it's felonies have to be quite a bit older, or when they're older, they don't count anymore. We also imagine with certain supportive housing, like with reentry, that we would have no barriers on that. And DECA, and right. So like we say these 7 units have this lower entry barrier because of who they're trying to serve. And so I think as we get those units up, we're more than happy to do that. And I think we'll learn a lot from lowering our barriers. I mean, part of our challenge was low amount of staff that just couldn't address those things without kind of a barrier. But now we want to address those, and if we have the support for those supportive services and wraparound services, we have no problem lowering those barriers.
Thanks, Rebecca. Any other questions?
Rebecca, and this also could be for Shannon. I want to go back to Sarah's question because I'm not sure I caught what might be the metric that we use to get, and it just to give you an idea what it might be, and I don't know that these are good ideas. Like, is it, stable housing so they're paying their rent on time? Like, how many of the people in supportive housing, what's the length of time they've been in that supportive housing? Again, these may be terrible ideas. The number of emergency calls we're getting to those locations, because we've heard from the fire department that they're having a lot of non-emergency calls, or calls that are really more about mental health, or some of the reasons we're creating supportive housing. Do you have specific thoughts about that? And then I have the same question about the landlord request that we have, Shannon. How will you measure that as well? So
I think length of housing by months is a great measurement.
Okay.
yeah, I mean, if we're trying to create stability for people with challenges and we're trying to meet those challenges so that they don't lose their housing, the best outcome measurement is how long are they housed? Now we know we might want to set our goals of that more reasonably than, the average person is housed in a place for 5 years. And I don't know that that's true. I don't think in Lawrence it is, probably a year. But, for this population, maybe it is a year is a great success if they're moving every a few months or don't have stable housing for months at a time through the cycle of homelessness. So I think we can talk about, how do we evaluate those measures? But I love, and we keep that information is easily reported of how long, what stability are we providing? And then I think the other thing would be how many interventions to keep that housing,
And
right?
that might be more with your partner organizations on data they're already collecting.
Right.
Yeah.
And I think with partners and with us, that piece of that trauma-informed rental manager, when do we go outside normal rental management, right? And send my full-time staff, Angie, who is, a trauma-informed case manager out to address an issue. And so getting kind of those numbers of because I think as a community, we're trying to learn, what does supportive service housing stability really require as far as hours and commitment from the collaborators?
Yeah, Commissioner Kelly, I'm really envisioning it, being entitled, trauma-informed landlord services for supportive service housing. And Rebecca reporting to us like how many folks she has working in that space. What are her other funding sources associated with it, if it's program revenues or something else? So it's not like we're tied to one FTE, but our dollars go into a service being provided by tenants, and then some metrics, length of service and, interventions. And then reporting to us all the different types of folks you're providing supportive services for, like you did in your request with domestic violence survivors and young adults and some of those types of things. So I think we're getting close to where we'd like to see this. So thanks. And then
Commissioners, I was just going to say also, we're experimenting in real time with tenants to homeowners in this kind of model with the Housing First pilot. We can talk about it a little bit more later in the conversation if you have questions, but the plan is to start referring folks to those units this month. And we're going to slowly integrate folks then slowly. And it's a Housing First pilot. So these folks are going to be the most challenging folks to serve. And we really feel like we have a solid group of folks to get together and start drafting some initial outcomes that we need to be tracking, that we can carry over into these larger projects that we're working on.
Shannon Lowry, Morris Douglas County Housing Authority. So I guess I just want to start with the overview that we have a lot of vouchers on the street, and we've had a lot of vouchers come online in the last couple of years between some of the special CARES Act funding, emergency housing vouchers. There are a lot of vouchers out there from other agencies through rapid rehousing. And what we're seeing is that we had to get people housed, and we got them housed without the support they needed. And one of the results or the impacts of that is that we are losing landlords at a shocking rate. We have lost, we calculated it up, the Housing Authority, we've lost 7 or 8 major landlords that amount to more than 1,000 units that people holding our vouchers used to have access to, that now they will not take a Section 8 voucher. So so this request and a lot of the things that the Housing Authority has been doing is to work on that side of our problem. Because we wish, like everyone at this table, we wish we just had one problem, but when we pull a thread in one place and try to do something some other place, it unravels. We got ESG funding from KHRC through the city for this landlord liaison project. We just found out we got renewed again for another year. But the housing authority, but that is really for targeted to our transitional housing folks, right? That is, and you know, Marielle, I mean, she gets the call from the landlord and she is reaching out to all of our community partners to try to find the caseworker all of the time. She knows how many of those calls that she gets. We track how many landlords we add. We track number of people because so for one part of our project, which is transitional type housing, we have 5 different transitional type housings. New Horizons is one of them. Basically, we track the folks for 2 years, and at the end of that, we determine their eligibility to graduate into a standard Section 8 voucher. So we know exactly how many people we are keeping housed. So those metrics are real easy for us to give you. They're in the packet. We're also trying to expand that landlord liaison to our regular Section 8. The metric will be more difficult to track, but because all of our funding comes from HUD and I have a complicated software system that thank goodness Galal knows how to run, we know how many months we provide assistance for anybody. We know how many people we get evicted. I mean, there is no, I mean, we can report on all of those things. So, but that's sort of why we are looking for that. We are also, we have to propose, we have an annual plan that we submit to HUD. We are putting $50,000 of our own funds into it. We have kind of have Marielle working in multiple different programs now so that the cost of her salary is not being borne just by the landlord liaison. We designed her position to be sustainable within the agency. I never want to hire somebody for 1 year grant funding cycle. And so before we hired her, we had a plan, we had a master plan. So these funds will not be for salary, will not be for office like that. It will be for trying to get some of these landlords back because a voucher is only as good as a landlord who will take it.
Thank you for that, Shannon. I just want to be cognizant of time and we're at about 11:35 and have a few other partners. Do we have any other questions for Housing Authority or tenants to homeowners at this time? Okay, thank you all. Any ideas about who we want to talk about next? Who we want to talk to next? We could just move down the row. Not about, sorry, I didn't mean to, that was, please forgive me on this 3rd day of budget hearings. Go ahead, Commissioner Kelly, if you have
So
suggestions.
maybe Lawrence Community Shelter, if we want to just go down the row.
That's what I was going to suggest too.
Yeah. So Melanie, thanks for being here. I'm interested to hear a little bit about, you know, there was a lot in your in the documentation you provided us about expanding services outside of emergency shelter. And we also have sort of a request, not sort of a request for our Housing Stabilization Court, or HSC. And I did see a little bit of overlap there. How are you working with the other agencies to make sure that we're not duplicating services?
As far as HSC, I know that we do utilize them a lot. From what I understand, that covers like emergency utility and rental assistance for people that are already currently in a lease. And most of our services as far as housing are for people that don't qualify for any other forms of assistance that we're aware of or are actively making their own choice, their own self-governance to not engage in other services for whatever that reason is. Some people don't want ongoing case management and they just want to get on their feet and move on. So some of those other options really don't fit them. But we do really hope that a lot of our people qualify for vouchers. So whenever we do have that opportunity, we definitely send applications that way. But unfortunately, a lot of our population, because we are seeing, partly because we're trying to follow the housing first guidance, most of the people coming into our services do have some of the highest barriers to housing. And because there aren't the adequate and appropriate housing options that they need to provide those supportive services, there's not a lot of options for them to exit. So we are seeing a higher percentage of the people we serve having the highest barriers for multiple reasons. So whenever we can get someone on a voucher and they don't have anything that would be, make them not eligible, we do that. If they qualify for services through Burt Nash and that's, and they do their intakes and they're eligible for those, then we do that as well. If we have, I'm trying to think of what other agencies that we work with, but whatever, if there are other options and they are willing to engage in those services, we always use those other options. Rapid rehousing does make services available to people that would otherwise be excluded from other services if they have specific types of felonies, if they have a history of multiple evictions, if they, sometimes if they owe a debt, I think for maybe tenants to homeowners, they might not be eligible unless they pay off that debt. So that's whenever we come into play to kind of be the safety net to catch those people, because every single one of those people deserve housing. It doesn't matter what their criminal background is. And because the ESG funds do not exclude them from services, then we try to catch, catch all those people that would otherwise slip through the cracks.
And we have case managers that are working with you now, right?
We do have case management.
Yeah.
Yes. And because we do have the housing team, we are able to provide the 2 years of case management for people that we are the sponsoring agency for housing vouchers. But we're also able to assist the other people that don't qualify for other assistance.
I think that's there's still some work that needs to be clarified in this space. Our funding was based around a model of emergency shelter. And I know you've had a number of conversations with the city of Lawrence about that. I know that I agree. I mean, folks aren't going to just leave the shelter without a lot of help. And who does that work and who stays with them? And this is, if it was easy, it had already been done. So I am not clear on that space and the financing for that space. So I don't, our funding has been allocated for emergency shelter. I know, but I think there is a hole and a need there, but I'm not quite sure how we're meeting it or at this point.
And which is why I think, in your packet, I had asked Melanie to put together the data that's on the spreadsheet that's in the book. It's the first page on the tab for Lawrence Community Shelter and on CAD 27 that breaks down how far the county's funding is going, the per bed cost and everything that goes into that at LCS. Melanie did a really good job talking through a lot of this at the presentation at the City Commission. But the spreadsheet gives you a nice snapshot of what all it takes to serve an individual, to shelter them on an annual basis, to shelter what the annual bed cost is, and then there's an estimate in that spreadsheet about how many folks they can realistically serve. And I thought, Melanie did a great job of contrasting how much it costs to support folks that are housed as well as and it's much more affordable. But as Sarah said, our initial, when we met with LCS earlier this year, going into the budget, the budget session, we explained exactly what Sarah just said, that our assumptions have been that we are funding the LCS at the amount we have been to provide emergency sheltering. Our intent for this year's conversation was to explain if it's not strictly emergency sheltering, what else what else is going into that 296 that we're funding each year? Tell us about that. And that was the intent of this spreadsheet, to help you all understand what all goes into that cost, that it can't just be straight up emergency sheltering. It's got to have some elements of the case management, the housing focused case management that goes into that. And the last thing I wanted to share in terms of collaborations, I think the collaboration point that I think is critical for LCS that I see on a routine basis is with the coordinated entry process. They have at least 2 folks there. Gabby is also a part of that. So she's got her ear to that group as well. But I think LCS is always at the table for the biweekly coordinated entry meetings, and then the every other week biweekly case conferencing for unique individuals. They always have someone there. And in my mind, that's a linchpin in the way this whole continuum works.
I do think we're going to need to, I need to figure out how to integrate this piece into the piece you submitted in April. So that's what I'm still a little unclear about. And the commission needs to understand that, not unlike the Heartland conversation, this is a shift in how our funding has been used. So frankly, it's up to the commission to decide if they're comfortable with how that approach has been changed. But
And I do want to say that every bed we offer at LCS is an emergency shelter bed. And the only internal services they receive while they're within emergency shelter services, they can either choose to engage towards housing services or they don't. And internally, there's only one position that engages in people or works with people that are engaging in housing services, and that's the housing navigator position that is funded by ESG funding. And mostly by ESG funding, but no county funds are going to that. And even that per bed only makes, and I don't have that spreadsheet in front of me, but it's just a few $100 difference per bed to help people fill out rental applications and to advocate with landlords and to send applications to the housing authority. And no county funds are going to that. There are more than enough expenses just to operate Lawrence Community Shelter for the city, the county, and more, for us just to staff the need as a housing first low barrier model. We know that most of our people need permanent supportive housing and they need those long-term supports. Those supports don't start when they move out of the shelter. They are in the shelter every day. And we do have the frontline workers are entry-level workers. They don't come to us with licenses or certificates, and most of them don't even have experience. And a lot of that is because we can't offer a competitive wage. For us to really support the community crisis response system and the way that we should, we do need a richer staffing model. We need more training. We need to be able to offer competitive wages. And with the current county funding, and I do know with the assessment that the county was the one that came up to the table and followed along with what those recommendations were. And honestly, LCS didn't. But also without the funding from every direction, it was impossible to support that. But I believe, I think I came to 12 emergency shelter beds for $296,000 with adequate staffing supports using the Erica Dvorsky assessment and also the American Red Cross guidance on emergency shelter staffing ratios for people with higher needs. I believe there wasn't a lot of evidence or research on exactly what the ratio should be, for those higher acuity individuals. But after looking at multiple sources, I kind of came down to one frontline worker per 15 to 20. And when you think about people that are getting residential mental health treatment or residential substance use treatment, and you think about one person with 20 people, that's a lot. It is a lot. And we do that every single day.
Other questions from commissioners? I don't have any questions. I just really want to contribute a comment that some people's definition of emergency shelter is extremely limited and narrow, and the belief that it's just about providing an alternative to an uninhabitable place, right? Or a place that's not meant for somebody to sleep. And so for me, it is a much more expansive definition than that. And as somebody who works in another emergency shelter in our community, the Willow used to be a 30-day shelter, and it created so many issues. And so going to a 90-day shelter, which LCS has done also, is about a move towards recognizing that more support and more continuity with those transitions out of emergency shelter into transitional housing or whatever level of housing they may be moving into with continued supports is critical. And I think that, so for me, it's a both and conversation that we need, that emergency shelter is a piece of housing first models across the board, and that some case management and some continuity of support beyond when people walk out of the shelter to go live somewhere else, that the services can't just stop there. So I just want to put that comment out there, and that is my perspective and praxis about what emergency shelter means. And I'm glad to see, I really liked in your proposal to realize that 90-day shelter stay that LCS has moved to, you haven't needed all of those 90 days for so many people because you have started implementing more services and supporting folks after they leave the shelter. And that is also cutting down on the amount of folks that are revolving back into your shelter seasonally or otherwise. So I just want to acknowledge that. And I think we have some more conversation to have about the amount of funding and what we've had conversations throughout this week with our community partners, what the sort of deliverables and outcomes are, so that we can really understand over time what the county investment of dollars is resulting in and make adjustments accordingly if we feel like we're missing the mark, or different gaps are being created because we haven't realized them before.
And I'd say though, that adjustment only happens when you come talk to us. So I think it is vital that if changes happen, that you're communicating with the county in terms of how you plan to operate and how the funds will be used. So it's important that we, as a partner, that we stay in the loop. And that's where I think we had some disconnect in terms of how this all comes together.
And one of the things that I've had this conversation with Melanie and Melissa and Sarah, that we fully expect to transition LCS out of a community partner agreement to get those 2 annual allocations and move them over to a service agreement that's similar to how we fund Bert Nash and DECA and Artists Helping the Homeless. So it's a reimbursement outcomes reporting based. We'll work on that collaboratively with LCS, and they're ready to have that conversation, which I'm really encouraged about. The last thing I wanted to mention is we had a really great meeting with Sheriff's Reentry staff recently as well about how we reboot a very seamless process for folks that are a good fit that are leaving the jail, that are working actively with reentry and need a place to stay and to have a solid working relationship with LCS as they did have in the past, and just needed to reboot that. And so included in these numbers, these assessments of the costs that were in that spreadsheet, is the assumption that 2 beds will always be available for starters for reentry clients. That's what Sheriff's Reentry has sought out, and that's what LCS thought was reasonable as well. And so we're really encouraged to see that partnership grow, and yeah.
So, and we have had a conversation with LCS about the ability to use some of our vouchers in their Monarch Village. And we think that will pass HQS. And so we are really looking to start that partnership up again to make sure those spaces are used, particularly for the folks that are really hard to house in a private landlord setting. And so we're also working on that side of it.
Last call for questions about LCS. Okay, thank you so much for joining us. You're welcome to stay. We're just gonna move on. And Janine from Trinity is here with us. And Sarah, am I right in that that's the last supplemental that we have to discuss today, right? I'll just open it up if any specific questions of commissioners. Janine, I really, I appreciate your proposal and have some heartache for you. I mean, I think that's been the story of the past several years preceding mine and Commissioner Portillo's time on this commission. And you can look and see that the requests have steadily gone up because of lack of options elsewhere. So, and I really believe in the need for Trinity services. What I'm worried about is that the amount of money that we may approve for this supplemental request doesn't come close enough to making a dent in the problem, quite frankly. So I just wonder if you can speak to that a little bit and talk to us about, you mentioned some other things you're kind of waiting on timelines for and some news from other entities. Can you give us any updates about that, or what I know you don't have a crystal ball, but.
Well, but the crystal ball actually provided some news not too long ago. HCBS did increase some of their reimbursements for IDD, especially. It went up quite a bit. And the individuals with developmental disabilities, yeah, IDD. So that went up considerably. What didn't go up was the frail elderly. And sometimes that it went up slightly. I mean, when I'm talking slightly, it's cents per hour. But so we do have quite a few of those clients. However, with this increase, we are looking at perhaps an additional $100,000 in our budget, which would help tremendously. Of course, we're still recovering from COVID. Is it over? I don't think it's over. My dad is in the hospital with it right now, and thank goodness he's doing well. But so, you know, we're still pulling out of that problem in terms of recruiting DSPs, our direct service professionals, and they are, we're just trying to keep ahead in terms of we have some that quit at the end of the school year because, you know, they're KU students, and then we need to hire. We're barely getting by with just enough workers to help with our current clientele. We have a waiting list of about 50 at this point, which is more than ever. And I don't see that going away, especially with the boomers as they age and that type of thing. They're going to need these services even more. I do appreciate the state being able to increase that, but it's like too little too late a lot of the times, because now we are competing for employees when Target and Starbucks are paying $16 and $17 an hour now. You know, and so some people are just going to go do that for part-time instead of, I mean, you have to have a heart to be able to work with our clients. And so we do have those that, this is their calling. So as soon as we, raise our rates and our wages, then it's like, okay, we're just reaching for the proverbial, castle in the sand, I guess. We just keep trying to get there and we think that we've arrived and then we haven't. So it's one of those things that we're going to continue to fight with. However, at this point in time, also, we have signed an agreement. I haven't seen the money yet, but we have been given money to provide $750 longevity bonuses to our employees at this time. Then we are also able to provide a hiring incentive of $750 after a 2-month work period. And that's coming from KDADs through CARES Act, that type of thing. And it's not unlike what they've done with some childcare and that type of thing. So we're excited about that. We hope that we're going to be able to waive that when KU students come back and we go to those part-time career fairs, whatever. So I'm hoping that we don't then have a great exodus after 2 months, but after the $750 bonus is provided. So, a lot of things we're still just looking and into the crystal ball and hoping and doing the best that we can and keeping our clients and our DSPs happy.
Other questions? I don't have any other questions. I just want to point out, because it's an important issue to me, I think that, we have a lot of community partner requests this year that speak to the impact of the pandemic and inflation in our economy right now, and the need to raise wages for staff retention. And we're seeing that not in all proposals, but a good majority of them is what it feels like. So it's certainly a pressure that I understand everybody's feeling. I think that Trinity's narrative in particular really illustrates the crisis of care workers and the crisis for care workers that we have across spectrums. I mean, I think we're feeling it at as we try and bring the treatment and recovery center online, having the proper staffed for that. And I think we're seeing it across, we've heard about it a little bit from the community shelter, from all kinds of agencies that provide care work. So I just, I guess I want to just highlight that. And we don't have any big answers here. It's a multifaceted issue. It's cultural. It's pretty cultural.
Yes,
We don't value care workers in our culture in general. And that has historically been true. So I do want to compliment, though, that I think that Trinity has been really intentional in trying to make up for the difference in every way that you can, and being really supportive to your employees. I've known folks that have worked for Trinity over the years, and that's a big reason that people like working there, even with the pay discrepancy. So I just appreciate that you are being thoughtful and creative about that, and that you're not just looking for workers, but you're trying to support those workers. And so I appreciated the examples of how you are supporting people who are low income also,
right.
And who have barriers and struggles of their own, and to be a supportive workplace matters to me. So I appreciate that.
Thank you.
Okay, last call for any questions or comments from Sarah. Okay, well, thank you all for joining us this morning. We appreciate it. Thanks everybody in our audience too. We appreciate you being here with us, and believe we're adjourned.
So commissioners, this was our last day of hearings with community partners and departments. We agreed yesterday to not meet tomorrow for deliberations and to start fresh on Monday morning. Commissioners will submit their worksheet to Cami and I on Sunday. Yep. Let us know if you have questions. along the way.
Will do.
Thank
Thanks
you.
for
I want to
recapping
really
that.
appreciate all your guys' time and attention in this process. And I know our community partners value having a seat at the table and being able to talk about their issues with you. So on behalf of staff and our partners, thank you.
Thanks, y'all. Have a good day.